Okay, good morning, everybody. Uh, we're going to talk about basic neuroimaging since we're done with the musculoskeletal of the both the upper and the lower extremity. So today we're going to talk about neuroimaging. Okay, so actually this lecture was taken from the lecture of uh, Department of Medicine uh, by Dr. Singh. He's from India. So neuroimaging modalities. What are the modalities that we use for neuroimaging? So first we have radiography, which is an X-ray, and next we have fluoroscopy. Fluoroscopy is a procedure in X-ray in which there is a an contrast that is injected to the patients. So it might be a form of um, diagnostic or interventional. When you say interventional treatment, okay. So we have the angiography that is for uh, angio means blood vessel, so that is for trying to check for the integrity of the blood vessel in the blood flow. If there's a blockage or uh, entanglement of the blood vessel. Then we have myelography. So myelography that is refers to the studying of the spinal cord. No? Then you have ultrasound. Okay, so in ultrasound, usually we use the Doppler, no? Ultrasound. Again, this is for studying blood vessels, especially in the neck area. Then you have your computed tomography. Okay, so CT scan. So you have CT scan angiography. You have perfusion CT angiography. Perfusion that refers to the studying of the blood flow, no, or returning of the blood flow to the certain areas which na shortened or nagka-hypoxemia or nagka-ischemia. Then you have your CT myelography. Again, this is a um, studying of the meninges, no, of the spine. Then you have your MRI. In MRI, there's a lot of procedure in MRI. So you have angiography, you have venography, you have arteriography. Again, these methods needs contrast. No, they have your different um, procedure for MRI, na diffusion and diffusion tensor MR, then perfusion MR. Okay, so then you have your nuclear medicines. So basically, these are all these modalities is used to produce image of the brain and spinal cord or the peripheral nerves. No? So basically, sa peripheral nerves ang ginagamit is this one, ultrasound. So we have here an X-ray. This is an example of an X-ray which displays the not only the skull but as well as the content, no, of the brain, content of the skull, and also it studies the spine. No? So basically, X-ray is very good in determining the integrity of your cranial and spinal cavity, where your central nervous system is located. Okay, so let's take for example for this one, you have here disorder of the spine. Although basically, it doesn't affect your spinal cord, but later on, if this is not corrected, that will impinge your spine. Example for this one, you have here the uh, laminectomy of the no, yeah, spinal fusion, no, rather of the C5 and is one. Usually, this is very common in patients with degenerative disorder. So this is a post-operative image that shows no anong nag-inaniman ni siya, of course tungod sa compression tingali diri sa iyang uh, cauda equina no branches diri sa L5 and this one. So gikuha na siya para ma-elevate ni siya kay nagtanaw na to ang space between the vertebra of the L5 and this one, it is already very small. So that means to say the peripheral nerves that exist in this area is already compressed. So that's why naiinani para actually para makunan siya og space nga di siya mag-collapse. Okay, so fluoroscopy is a real-time X-ray. So it is done with again with the contrast. So when you say real-time, it is done. The imaging is done on the actual procedure. It is magnified or dito makita sa screen sa monitor. And then again, it could be interventional. So when you say interventional na andra ang image, so let's take for example magtaod sa stent sa heart, no? Pwede na siya or dito ba kaha sa brain. While na aga perform ang X-ray, pwede na siya nga butangan siya o mag-stent siya, no? So it's a little bit complicated procedure, no? Kay abot man gyud dito siya sa imuhang utok, no? So this is an example of fluoroscopy in real-time X-ray. Here we have study of the flow of the blood to your to the brain. No? So kani makita nato these are your internal carotid, no? Kaputol niya. So tanawan nimo this is the flow of the blood towards that area sa brain. So this is the circle of Willis. So tanawa kaning flow sa blood towards this section. What happened to that? Diba wala no? Wala itong naman pero gamay. So that means to say that the flow of the blood in that area is very small. So it might be that this area is suffering from ischemia. Inana. Okay. So this is an example. So look at this one. This is a branch of a blood vessel. But look at the flow of blood in that area. Gamay. So you can assure this is a carotid. Okay, so they have here the study of spinal cord. So sa myelography, this is in the lumbar area section. So what happened to the cord? I think it was compressed. No? So usually the contrast is injected no, intrathecally. So this is an example. No? The contrast is injected here. Intrathecal means this is spine, usually subdural, to produce the image. So inana na siya. So this is to trace if there are parts of your spinal cord that is compressed or peripheral nerve that is compressed in the sa agyanan niya, no? Sa intervertebral foramen. Okay, so this is we have here the image of sample image of the brain. So here we can find out the image of the brain. No? This is in CT scan. In Hounsfield unit. So that is in CT scan. No? Okay, here this is the anterior part and this is the posterior part. We have here this is your ventricles no sa brain kung asa na siya naga-produce og CSF. So you will notice that the image of the brain no kanang katong mga gagmay siya wala siya fluid ang ihang image is from dark to light gray. But if there are areas nga naay black, kanang black that signifies for fluid. Okay. Sir na malagi ka na puti. This is already a classic calcifications, no kana siya. So ang bukog puti. So kanang mga puti na dira, that is already calcifications. So, yeah, makita na to sa brain. So we have computed tomography. We have two windows, the soft tissue window and the bone window. So usually in bone window, it is used to establish if there are problems in the bone structure. That's why it's called bone window. So to check if your bone integrity are intact, no? Or in soft tissue, that refers to the soft tissue found inside your spinal cavity and your cranial cavity. If there is something wrong with the brain or spinal cord. So let's take for example, we have here the soft windows. Here we can see the classic, no? This is your cerebrum, no, cerebellum rather. So here, sir, ganun kana raman makita nga soft tissue because there are other no soft tissue involved if we try to cut the section here in the level sa ears nato. Oh, this is your auditory meatus. Tunggan man na siya. Ang kita lang nato nira are some sinuses and soft tissue sa imong nasal cavity and part sa imong cerebellum. Kani, din kani matama na, no? Then, kani nasal cavity. These are your sinuses sa imong ethmoid. Kani maxilla zygomatic area, temporal, auditory meatus, because so kani this is bone window. So to check if your bone are intact. So ana. So these are facial bone. No? So kani bukog na siya. So sir nganong naiitom-itom na these are cavity not cavity actually. These are your kanang marrow, no? Bone marrow tanawan na mga lattices. It is your bone marrow or your red bone marrow. Yung part na siya sa diri no skillet sa imong occipital diri na ay mga red bone marrow. So kana siya. So the CT scan indications that is for skull and skull-based vertebra. So to detect if there are trauma or bone lesions. It could also detect sa imong presence sa ventricles nimo kung unsay ilang integrity, kung naay by obstructions or na accumulations of fluid in your ventricles, which needs to be shunt. Then you have your intracranial masses, you can detect that. So usually this is done, no, ang CT scan sa mga mass if you have this kind of symptoms. Headache, sakit sa ulo, nausea, vomiting, visual symptoms, and etc. No, dizziness, vertigo. So these are symptoms nga na especially kung ang pain nimo is increasing, no, ang intensity niya is increasing every day. So that might be an indications of mass in the brain, no? Ga increase ang iyang kadakuon. Hemorrhage or ischemia. Okay. So usually this is done in acute, no? During stroke, immediately if you want to have an images of the brain, so instead of using MRI, you use CT scan because CT scan is more sensitive in acute stage. But if after 3 days, then you, MRI, CT scan rather, after 3 days ay maka MRI. So usually, if there are mental status change, no, unsa man ang mga mental status change na may problema. Makalimot na siya, di na siya kailan nimo. No, sudden ra kaayo na usab ang personality. No, mag-istorya siya, di na siya maminaw siya, ang tubag niya lahi. No? Calcifications. So na ay lesions dito sa brain. So these are example of intracranial masses nga nahitabo sa ato ang brain. Solid mass. Asa man ang solid mass? Okay, here is an example. Supposedly, ang appearance ani na siya murag butterfly diri. Wala. So these are masses na naa sa brain. Kani pod at dili ito siya kay prominent. Mas dako ang diri. Oh, kani. These are example of calcifications na makita nato. Ang puti-puti. Those are calcifications, which means to say nga kanang ang part sa brain is nagahi na, nag-calcify. When you see calcify, gahi. Then you have here an example of area sa imuhang, this is the anterior, this is the posterior. So this is the part of your cerebellum. So that is an example of mass. Na tubig man na, di ba? Itong gusto ko fluid. Parehani. Okay, this is an example, another example. So here, we have the left hemisphere. So yun, gano'n nakaingon siya swelling. Supposedly mo niyang appearance po diri sa pikas, ana, din na po siya inan. At what happens sa brain? Nawala ang iyahang kaniyang gyrus and sulci. Di ba? Kaniyo, ang iyang central sulcus, wala na diri sa pikas. Tikot na. So inana, so this is swelling. So kung pasabot, kani siya ubag, no? Burot. Expanded. So ang fluid ani na sa sulod dili sa gawas ha. Kung sa gawas, how do we know nga naa siya sa gawas? Kani siya makompress na mo kipos ni, no? Mo gamay. So kani ang fluid na diri nag-accumulate sa sulod sa tissues. Nag-edema ang imong utok. So this is an example of generalized swelling. Sir, nga nung nakaingon ka nga generalized, look at the gyrus or the sulci of the brain. Wala na, absent na. Kani siya, these are all tissue fluid, no? Interstitial. Ana siya. Oh, these are sinuses, no? Frontal sinus. So, ang cut na niya dito level sa mata. Oh, no, above sa eye. So, this is an example of a hemorrhagic nga klase sa mga image, no? So, you have intraparenchymal. So, when you see parenchyma, that is within the tissue. Hemorrhage. Okay? Subarachnoid. So, subarachnoid is between the dura and the arachnoid villi. Ano? That is between the arachnoid villi and the pia. So, that is subarachnoid. Then, subdura, that is below the dura but above the arachnoid villi. And epidural means naara siya sa gawas. Peripheral sa dura. So, it is between the skull and your dura. So kana makita na to, this is intraparenchymal, susulod sa parenchyma, sulod within the brain tissue. No, kani dugay-dugay na siya nga klase sa hemorrhage, no, kay nag-calcify naman, nagsugod na siya calcifications, ang puti na. So look at the appearance of here, wala na, no? Ang ihang brain, nag-shift na tong sa center diri or corpus callosum, di ba? Wala na, nag-shift na paingon diri sa pikas. So the pressure within this is building up. Means to say, ganag hinahinay siya ka compress ang brain. No? And then, we have here subarachnoid. So, subarachnoid means it is between the dura and the arachnoid. So, asa mo siya dapit ang imong swelling or ang hemorrhage na hitabo. Let's look at the deviation sa ato ang brain. Each part of the brain has deviated. Ni gamay ug ni dako. Here, di ba? Notice ni kani ang contour dako pa na, no? So diri sa right side, tanaw na to, tanawan yon, collapse. Wala na siya. So this is part of the brain that is compressed by the inflammation no? So anterior, posterior. So probably sa occiput niya, occipital lobe, so na-compress siya. Fluid accumulations is during an area just below the arachnoid space. Ah, below the arachnoid villi. And here, subdural, kita na to. So you assess here, ang kaning part sa brain. Okay pa na siya ta merong butterfly. So kita na to nawala ang butterfly diri na itom pero na calcification diri calcifications. And here kaning nga part sa brain, tanawan nyo kani kita mo na light gray nga nasa border. Kani this is the skull. Kani so this is an example of subdural hematoma below the dura, between the dura and your arachnoid. Ng subdural ng tawag. So naa siya sa superficial lang sa brain. However, it affects the brain. Why? Because it compresses the brain towards this area. Kana o, dibidid siya pa yung nada. Kani nga area o, ning gamay. No? And this is the epidural, means between the skull and your dura mater. So kana, no? So kani massive man ni siya ang sa epidural hemorrhage niya. Ano man? Look at this one. The face here, wala. So it is compressing the brain towards that area. Parang nipikot. So kana siya, no? Kana na siya sa gawas. Okay, so we have here acute ischemia. How do we know, no? Mawala ang loss of gray-white distinction in swelling in non-arterial territory. So makita nato dira, ano? Acute ischemia. Unsa may iyang appearance? Loss of gray-white. So pasabot ang iyang appearance sa tissue nimo is what? Somewhat going to black-gray ang appearance. So, if you're going to assess the tissue of the brain with that kind of appearance here, so this is an appearance of the tissue that lost its oxygenation. No? Sugo na siya itom. Kaya na siya from gray to black. And here on the other side also, gray to black. Okay? So this part of the brain is experiencing ischemia. Look at the definition of the sulci and the gyrus. Here on the other side, it is, you can easily distinguish the sulci and the gyrus. But here, wala na. Okay? Plus, if you look at here, kana, that is an example of calcifications within the ventricles. Okay, ventricles man na drang area class. Okay, so that's an example of classic calcifications brain, no, with persons with hyperparathyroidism. So, mauday na nga ang patient, no, when you are adult and you experience hyperparathyroidism, later on your brain functions will be affected because you have calcifications that will happen in your brain. So, matingala ka nga deteriorate nga nagka-deteriorate ang individual. Dili tuod siya kung bata ka magka-mental retardation man, no? Pero sa adult dili. Hinahina lang magka-deteriorate lang ang brain functions niya. So na, tungod aning presence of calcifications. Okay. Aside from calcifications, look at this part of the brain compared this to the other area. Asa naman ang gyrus and gyri? So nawala. So probably this one is also, aside from there's calcifications, there's also fluid build up in the brain. Yan naman, si tanawan nimo ang sulci, diri okay pa na, diri pero pag abot diri wala na. So probably because of the presence of these calcifications, that would result to mahitabo na siya nga na fluid accumulations. That will compress some part of the brain kay mag-accumulate ng fluid, magkahubag, no, ang imuhang parenchyma sa imong brain. So here we have CT perfusion. So This refers to the blood supply sa brain. Kung asa dapit nga part sa brain ang daghang uh, blood nga naga-circulate. Usually, kani siya gina-perform ni siya to detect no, kung dapit ang naga-function. So, sa mga no, sa mga patients nga na-stroke, so kung i-check nila kung asa dapit nga part sa brain ang na accumulation sa fluid or na ay restriction sa fluid or restriction sa blood flow. So usually, mga area sa brain nga na restriction sa blood flow, makita nila na lahi ang color. Kung high taas pod ang ang blood flow drag area, makita po nila kung labi na kung na mga edema, na hemorrhage, no, drag area nga magpula pod kaayo, no. Sobra-sobra sad. Subot pa sabot na ay extravasation of blood in that area, no. So sa mga hemorrhagic na process sa stroke, makita na nila using this one, no, CT perfusion niya technique. So here, makita na nato. So kani, there are certain parts of the brain which is highly active. So common siya no, sa mga lateralizations, mga right side sa brain, active kayo siya sa mga left-handed. Sana mga blood flow niya. So kani kulang na siya, no? Gamay, diri taas. Yan na. So kani siya, ginagamit ni siyang CT perfusion to map your activity sa blood or movement sa blood sa brain. Now, the movement of the blood depends on the activity of the individual. Kung naguna-una siya dalom, ang ihabang nahuna iyang uyab. So, emotionally, so probably dito siya limbic system. Ma-concentrate ang blood. Nag-solve ba siya problem sa math? So, probably sa frontal lobe niya. So, depende no, kung asan siya. So, this is used for mapping no, ang CT perfusion. Or sometimes, to detect po sa parts of brain nga kulangan of blood supply or na ischemia. Pwede din siya gamitin. Myelography. You have CT myelography that is spinal. No? Okay, myeloman that is spinal. Spine. Spinal CT immediately following conventional myelogram. So usually in conventional myelogram, we use the X-ray. So cross-sectional view of the spinal canal along with the spinal cord or nerve root. So this is to check if there are spinal stenosis or nerve root compressions, secondary to disc herniation, vertebral fracture, or neoplasms. So example ana, no? So this is a CT myelogram. Oh, so kani, so this is the cord in the middle. So your lamina, this is the pedicle, kani pedicle na siya. Then you have your lamina, spinous process, vertebral body. So look at that. So there's a fragment here. So kani siya, unsa man na sir nga namin siga. So this is an artifact. So that is a book about metal. CT scan. So look at this part. So kani tabo ana, indicate ang imong this is vertebral body, kanal. Ako kayo diri ang intervertebral foramen diri sa pikas tanawan nyo. It's bone, gamay. So that means to say, pwede nga maipit na siya diri ang peripheral nerve. Okay, so here we have another one. This is coronal cut. No? So here you have your intervertebral foramen on the left and right. Look at the intervertebral foramen in this area or in this section of your. So usually this is now in cauda equina, no? Sa tip na ni siya sa spinal cord, no? L2. So kanan din tanawon niyo ang clearance intervertebral foramen. kani siya gamay, ba? So apply gyapon na alignment. See here, space, tack, tack. What happened now? This is an example of herniation. Paingan central vertebral body ang nag-herniate ang imong nucleus pulposus. So here the space is very small, so nagkulak. And plus ani, what is this one? Kanang itong. That is herniation again of the cord. So paipit maipit, so dua isa, dua no. T9, T10 na siya herniation. T10 and T11 na siya compression. Disc herniation sa central. Then napo si peripheral, no? So, probably any manifestation na yun rin, no? T9, T10, T11 makita. So what we need to know, if you have CT scan, these are the one. So if air, so may appearance niya is very black. Water CSF is black, so kana siya, no? Kana hindi siya CSF ha. That is your nucleus pulposus na nag-herniate na pagawas. So bone is very dense, which is white. Blood is white. Brain is gray. Ano yung appearance, no, sa CT scan. So, look at here, sir, kay na naglibusod mo padaraw asang problema dito. Here we can identify now usay kalaina. Ventricles are normal size. The gray versus white distinction is clear. Midline is straight. So look at this one. This is your ventricles. Kana. Ano yung appearance normal ng ventricles? In fact, if you're going to draw, kay kani siya drain na siya level, no? So forehead. So if ma-level na siya dapit sa ubos pagamay, ang ventricles ani diri is kana connected na siya butterfly appearance. Then kani tan-awon mo ni siya if the midline are straight. Sulci are symmetrical. When you look for the sulci, kana siya kana mga namurag naglinya niya, no? Depressions. Kay ang gaburot gyrus man. The skull is intact. Kani siya ang puti. That is skull. Wala by interruptions. So with no scalp edema. So ang scalp edema is kana diri, kaning in between ani ano siya dira. So compare, no, systemic approach of head CT scan. Compare left and right hemisphere sa imong cranium. So symmetry sa hemisphere mo, left and right, midline. Look for midline shift. Kung kani ba siya naggamay na diri pikas niya diri nag-ana. No? Then cross-sectional anatomy review, anatomical landmark for each slide. Brain tissue, gray matter, white matter. So these are no imong tan-awon. CSF space. So asa man ang CSF space kani diri, this is the ventricle na ana siya dra na by changes sa butterfly appearance. Nausab siya, no? Next, skull and soft tissue. So you check for the skull if there are swelling in this area peripherally. Subdural windows, look for blood collection adjacent to the skull. So if there are blood collection in this area, ana subdural kana surround sa brain, no? Dira. And then you have your bone windows that refers to the bones kani ba diri buhog kung naa bay mga problema or fracture. So here you can identify, no, these are the level of cut. This is cross-sectional cut, no, sa ana. So kani diri makita nato na ang ventricles. So as we go down, kani level na siya sa eye, third ventricle. Then you have your fourth. The fifth, makita na ang midbrain in the cerebellum. So depende kung asa dapit ang cut sa imuhang CT scan or MRI with just this one. So cross-sectional, this is the first no nga level. Kana diri siya central, no, that is the first. So makita nato paired of crescent shape kana crescent shape. So murag na crescent moon. So intact na siya. So you have twin bananas there. So you have there the corpus callosum, kana siya diri surround ani diri corpus callosum. Then you have here the body of the ventricles. Ano siya. So here we could find no, sa mga structure na to. This is the sulci and the gyros. So makita nato dira whatever areas ang affected. Let's take for example if this one are na siya tumor, so ang affected dira is the putamen, the gluteus pallidus, lentiform. So movement niya is affected as well as ang mga sensory. Yan, no? Kay putamen dito sa cord nimo, diba? You have your caudate nucleus, globus pallidus, putamen daw dito sa imo sa likod sa spinal cord. Third ventricle. So kani siya digdi ang alignment ani niya. So these are the basal ganglia. Makita na siya. So kato siyang nakita nimo nga twin bananas, diri siya nga cut class. Then you have your third ventricle. So sa third ventricle, asa na siya dapit nga cut? Kani siya, no, level ni siya sa brainstem. Brainstem. So here we can find now this one. This is the frontal. No, kani siya. So kaning area manini mo ha diri brainstem. Oh, no. Yeah, no. Brainstem diri area. Paingon na siya dito sa first ano nat lateral ventricles then duol na siya sa imong nat brainstem. Actually diencephalon di ay, no. Diencephalon. Kanina amo guni siyang mata diri oh. Which serves as your choroid plexuses. Ana. Then so you have here so ito nga pineal gland, so this is in the diencephalon, no, kana diencephalon area na siya. So makita nato dira pineal gland na basto nga basal ganglia kani pikas middle age, young age, septicemia. So makita nato diri no kung ay mga tumor calcifications dira. Then you have your choroid plexus dora. So diri nga area. So base na ni siya sa usipot dapit. Okay, so this one kani parts sa cerebellum. So you have now here the smiley face. So kani mo ni yung mouth ana mo ni yung normal nga appearance dito sa third ventricle ay sa smiley face. Kani cerebellum na ni kani nga portion. Yan midbrain interpendicular cistern. So mo ni yung appearance. So midbrain, when you say midbrain, ana na siya sa first part sa imong kani diri nga part. This is the midbrain. Ana siya nga part sa imong kani naana siya sa dito sa brainstem. That is the normal appearance niya. Here, star shape, but pasabot kani siya star. So kani diri na diri ang circle of Willis. So kani mo na yung base sa imong brain. No? Mana siya, paingon na siya kani this is part now of your pons. So kana siya, so this is the anterior part. So nana diri ang imong anterior circulation with MCA, then PCA. Kani pathway na siya sa PCA. Posterior cerebral artery. Kani sa MCA, kani diri ECA. Anterior cerebral. Kani siya circle of Willis. Kani these are sinuses nga naa sa imong skull, no? Sa base sa skull. So nana siya. Kani ubos na pud siya nga part sa base na gini siya, no? So makita na nato ang sa kani ilalang frontal. So kani siya diri nga area, that is already where your nagsulod ang imong olfactory, no? So, kani nga kuan sa frontal lobe. Then kani part ni siya sa temporal. Then kani this is your cerebellum. Okay, so diri nga part medulla oblongata na ni siya. Diri kani nga section. So kani nasa ilalang pagid na siya. So this is the cerebellum. Kani part sa imong kuan pa sa temporal lobe. Then kani mata na eye. So kani bukog na ni siya, ethmoid bone na ni kay nasal cavity naman ni area. So inana siya class. Green is temporal. There that is denotes the frontal lobe. Okay, so kanay nagpasaka siya going up na, no? Frontal lobe, then the green, temporal. So this is going up now. Nagkadako naman siya until sa time appear ang occipital lobe. So this is the frontal, this is the temporal. So you notice, nagkawala na to ang dirigay na gamay pa ang going back. So gamay pa dire ang occipital because of the presence here. This is your ganito, cerebellum. So inana siya ang image class sa imong brain. Normal. It's normal ha, wala pa na siya sakit. So here, this is the ventricle. Slowly, if you look at the banana starts to disappear, no? So really present. No, ana siya. So red frontal, ang blue na siya parietal, so nagasaka going up na siya, no? Diri na siya dapit. Temporal, then you have here the occipital lobe. So kani part sa parietal ang blue. Kaya nakagamay naman na imong temporal. Later on, mawala gyud siya because ang makita lang nato is the frontal, the parietal, and occipital. Just like this one. Okay, so with that, ang makita na nato naana ang banana. Diba? Slowly kani siya din na sa top. Kaya wala naman tong banana dire. So inana siya sa CT scan. So it's very kwa lang siya, no? Dali ra siya makitaan na imo ang image, no, sa brain niya na ay problema. Ato naging bantayan ang katong ang iyang appearance sa tissue. Ha? Appearance sa tissue diri kung unsay color. So kanin these are the no? Bantayan nato. Ventricles are sized. Ana, then ang banana nato, no? Kani siya mga pag-assist niya. Symmetry sa left and right. Left and right, symmetry. And then midline, if there are midline shift, by shifting. And then you have your brain tissue, gray matter, white matter. So makita na nato siya, ano? Kana gray matter na siya, ang white kana diri sa tunga. Okay, so kani CSF na, ano? So this is ventricles, produces CSF. So you have your skull and soft tissue, so there are any swelling. And then ang color, no, sa reading. Ito gay na ito, itaan sa nako to, ha. Sa color sa tissues nato nga naa sa brain. No? Okay ba? Okay. Kani intensity. So air is very black, water is black, bone is very dense, so it is white, blood white, brain is gray. Nantigam na, no? So kana white, that is bones. Kung dili na siya nag-white, that is calcifications or blood. Okay? So ang color sa ato ang kwan brain is gray. No, kanang itom that is CSF. No, subot pa sabot ventricles na naadra ang foreign plexus. So symmetry, we are going to look at the symmetry ana sa hemisphere. Shifting there is a tunga if the tissue shifts here. Example sa shifting, ano balikan ako ha. Example ana, no. So these are the color. So gray, mo ni siya normal. Kani nag-black naman na siya paingon sa black. So this is an example of tissue nga na fluid sa sulod. Di ba? Kana inana. Symmetry sa imuhang hemisphere, solsi. Ana. Diri wala na. Mao gyapon ni spikas. Shifting. Okay, midline. Oh, naaman siya midline, sir. Yes, but look at the kani. Saan ini? Kanang ventricles. Naaba siya sa pikas diri? Wala. Diri, tanawan ninyo. Oh. Wala. Di sa pikas. So inana siya atong tigamnan. Another one. Kani. Okay, kana. Midline. Draw a line. Tak. Straight ba? Dili. Kaya nga naman because, tanawan ninyo diri. So na shifting. Symmetry. Tanawan na itong symmetry. Kana diri sa pikas. Gray. Tak. Di ba? Again, kani. Midline. Straight ba? Dili. About kaning surfaces niya, tanaw na to. Diri intact man, okay, una, so siya nag-shadow. Diri wala na. Okay na siya. Oh. Kasamot na diri. So na lang siya pag-check class sa CT scan. So dali ra siya. Actually ang sa ato ang pag-check. So let's go now to MRI. Okay. So sa MRI, you have here a patient is put in the middle. Okay. So subject for magnetic field. Pag sa magnetic field, since our bodies have positive and negative ions, these ions are being rearranged. So gina-rearrange na sila. This rearrangement of ions in our body produces now, it provides a feedback to the receiver. This receiver send this feedback to your receiver signal in the computer. In the computer, this rearrangement of ions in your body is producing now an image, no, through the computer. So nana siya mag-interpret dito. Ano niya ang appearance na yon? Okay? So, based on absorption on the emitting of radio frequency energy. So there is no ionizing radiation. So again, wala siya ionizing radiation. This is just a reminder. Basta may naan niya ani. So magnetic field. So magnetism. So ang unit sa magnetic nga na-exert sa magnetic resonance imaging is in the form of Tesla. Okay? So the magnetic field causes the protons in the body to align. Then pulse radio waves are directed to the patient causing a disturbance in proton alignment. Proton disturbance sa proton alignment, gina-detect na niya. So, mo to siya makaproduce sa image. No? Pag-send back niya dito sa receiver. Okay. So, na siya relaxation time. So, muna siya imong T1. Then, the T2, transverse, ng magnetic field. And ang T1, longitudinal na siya. No? So, sa short, nimo nga T1, so na short TR, which is, what is TR? Repetition time. And short TE, what is TE? Echo time, that is T1 weighted. Ang ilang appearance na is the CSF nimo is dark, okay, increased water, edema, tumor, infarct, inflammations, infections, hemorrhoids, chronic, low proton density, calcifications, and flow void. So that is dark. Ang white nimo dira, bright white is the fat, subacute hemorrhage, melanin, protein-rich fluid, slowly flowing blood, gadolinum, laminar necrosis, ban infarct, man sila ang bright sa T1. So, ang imong CSF is dark. Okay, take note of that. Sa T2, wherein there is long transient relaxation time and long echo time, reverse. Ang imong dark, nani, protein-rich fluid, flow void, substances such as deoxyhemoglobin, methylhemoglobin, iron, hemosiderin, dark na sila. Ang bright nimo ang CSF, tumor, water, infection. So, white na sila. So, ina na siya, no? Then you have your flare, fluid attenuated inversion recovery. So, basically, we're in the T2 without CSF brightness. So, kani siya, minus na siya sa CSF brightness. Pero, and the rest, naagyapon. Medyo pro pareha sila sa T2, ang flare nga sequence. So, edema and gliosis, when you say gliosis is, ang imuhang supporting cells are nag-calcify, no? Hyper intense ang ilahang appearance. So this is now your T1. So look at the T1. Di ba, yung pagay na, CSF is black. No? So this, going back here, CSF is black, edema, tumor, infarct, inflammation, hemorrhagic, low proton density. Ang imuhang bright dra is fat, subarachnoid, hemorrhage, melanin, protein rich. So kani, no? So kani kay mga protein rich man na, no? So medyo mga puti-puti, no? Pero the rest of the fluid, they are black, CSF. So CSF na siya diri. Kana so nga CSF na. So kani mga void space, no? Kana void space man na siya dira, black. So white, tambok, wala kayo siya fats, diba? So T2, reverse. So here you have now the CSF becomes white. Kanina black. So this is now unsa man ang black sa T2? Ano na to? Unsa man ang black sa T2? Calcification fibrous pragmatic paramagnetic substances. So kana protein rich fluid, fluid void. So CSF mo is protein rich fluid. So black. Kanina these are gray matter, soft tissue. Space. So ano siya class? Fat suppression. So here, kikita void space. Black T1. So fluid na CSF edema. Pero kung nag-bright na siya diri, buto sa blood. No? Okay? Diba? Bright sa T2, tumor, infarct, inflammations, water. Kung dire na siya, edema, tumor, infarct. So this is probably tumor yun siya, or fluid. So deviations. Tanaw na to, ang linya, ba? Ipit. Nihiwi ang mata. Gamay. So, normal, inana iyang space. Kung magigamay siya, pareha naggamay. So, muna siya na siya edema. Here, imaging diffusion. Puti. So, this is what? ischemic tissues. So no other imaging is more sensitive to acute ischemia than the MRI. So these are ischemic tissues. Magpasabot, barado ang supply sa blood diri nga part sa brain. So man nga part sa brain. So this is now your temporoparietal area. So sa MCA infarctions. So parietal, affected yun ang parietal. From gamay sa frontal. Temporoparietal. So inhana siya. Makita nimo no. Although perfusion imaging reveals hypoperfused tissue at risk for ischemia. So pwede ni siya nimo dito sa CT scan with perfusion. So makita nato siya kaning area wala ni siya blood redness. Might be nga nag-blur na siya dra. So we can detect that even in few hours. So DWI, no? Angiography. So this is an example of angiography. So these are circle of Willis. So makita na to, ang circle of Willis na ato siya inani. Pero diri sa pikas wala. So pasabot ang supply nga gikan diri nga branch sa gikan sa imong basilar asaka didto. Ano, that's carotid, no? Gikan ni carotid. Kani man ni siyang basilar. This is the basilar, this is the vertebral. Look at the other vertebral artery. Wala. So walay supply coming here from vertebral artery sa left. Oh no, right, no? Sa right. Kanina aman sa left. Here, pagdita na to communicating arteries here. Kay ACA man na, dahil supposedly na communicating artery, wala po. So these are example no sa angiography, it's very clear yun sa blood vessel. Sa CT. Here is example. Another one. So this is your gikan na siya sa vertebra. This is cervical. Vertebral. Nag-fuse to form the visceral. So kani siya diri wala siya supply. Barado. So sa perfusion niya, with perfusion, kita diri kani ischemic. Wala siya diri kay wala gid siya no na pa yung tanana wala. Kulang man. So tissue contrasting MMR may be based on proton density, water fat protein content, metabolic compounds such as choline, creatinine, acetyl aspartate, lactate, magnetic properties of specific molecules, and hemoglobin. Diffusion of water, perfusion, capillary blood flow, bulk flow, large vessel. No? Then we have here contrast. So kuha na lang na siya ang contrast. Walahin na lang na siya, no? Pero gamay naman lang. So in contrast, IV contrast neuroimaging, ang ginagamit na to sa CT scan. So we have here the iodine-based. So sa MRI, we have gadolinium-based nga contrast. So the tissue that gets brighter with IV contrast is said to enhance brightness. So magka-clear siya, no? Kung na-i contrast. Usually mag-bright siya. So ang problema lang sa contrast, ang makita nato blood vessel lang yun. But dito sa sulod sa brain, we cannot. Why? Because of the blood-brain barrier. So ang ato makita sa mag-angiographista is only the flow sa blood vessel. Kung absent ba or wala. Pero within the tissue, dili nato makitaan kung may naaba siya activity dito. But of course, pwede na to siya usbon, no? Dito ta sa perfusion. Again, kung makita na to ang activity sa brain. Kung wala ba siya activity, kasi sa ischemia, no? So magpula siya or whatever, mag-short, no, ang iyang supply sa oxygen. So dito nato na siya magitaan sa perfusion sa tissue procedure. Okay, so inana. So example ani. So this is an example of enhancement. So this is T1 only. Here we have brain enhancing lesion. So it can be a parasitic infection sa brain. Okay, nagputi siya. So kana mo na ihang fluid. So if we put so enhancing so parasite or tumor pwede na siya ng metastasis man melanoma cancer. So this is in ordinary T1. Makita na to siya ang fluid okay ra pero nagputi. So infarct ni siya calcifications. So gibutangan niya og enhancement with contrast. Na by changes wala mao man gyapon. Kaya nga naman because the contrast only changes sa flow diri sa blood, no? Diri outside ra na siya makita. Kanira ang change ana wala na. No changes. So di siya ka-penetrate sa tissues. But of course, na-enhance siya, no? Na-promote, nagkita pa gyud ang ring. Pero the same raman gyapon na sila di kani natin change. Gamay ra gyud. So mora na siya no sa if you are studying the tissues sa brain, ang imuhang gani contrast only nindot siya tan-awon sa angiography, no? So when it comes to the tissue, dili kayo siya maka-enhance. Okay, thank you. Since this is only introductory, I will post another lecture about this is the brain. Then I will post another lecture about spinal cord.